Well, welcome to our conversation around leadership through this pandemic and quite a transformative year. I am Melissa Andrews, and I was invited to moderate this panel. I'm the president and CEO of Leading Age Virginia. I also had the opportunity to go through the Larry Minnick's Leading Age Leadership Academy class of 2010. And that really is the connection of most people on this phone. All of us are alums of that program, and one of us will be starting the program in January. And so when I was asked to record this session, I really thought about the fact that this group of leaders in our field all have the same foundation in philosophy and principles and practice regarding leadership that we learned in the Leadership Academy. And through the decade plus since we've gone through that program, I was interested in how each of these leaders have changed, augmented their leadership style through this pandemic, what lessons they've learned, how they have tapped into their incomplete leadership, how they have dealt with the imposter syndrome that I know we all feel in the best of times, much less in the time of COVID, how they have remained on the dance floor and the balcony. So these are all terms that you learn in the academy, and I know that that for many of us, they are the themes with which we lead. So as we begin our conversation, I'm going to start with Diana Delgado, who is coming to us from Denver, Colorado. And thanks for being here, Diana. If you would tell us a little bit about you and Eaton Communities, and just talk about what leadership through 2020 has been like for you.
Thank you, Melissa. Again, I'm Diana Delgado. I'm the Executive Vice President at Eaton Senior Communities in Lakewood, Colorado, which is a suburb of Denver. We serve 225 residents in our affordable and middle market community campus. I'm very honored to be here today speaking with all of you. We had an intern working with us this semester, and her project was to analyze our leadership during COVID. So this is a very timely discussion for me. She presented her results to our CEO and I last week. And so there's been some themes that came out of that I'll just share with you today. The first thing being, Simon Sinek said, true leadership isn't reserved for the few who sit at the top. It's the responsibility of anyone who belongs to a group, and that means all of us. So we really have seen a lot of people step up in our organization as we're all trying to work together through this pandemic. And the interviews that she did was with our entire leadership team. And she identified 4 main leadership styles that we're using currently in the organization: collaboration, engagement, transformational leadership, and a relaxed environment, which I thought was really interesting because, we're affordable housing, we're independent living. So, we don't have the healthcare component of us actually providing care to our residents. So I'm interested to hear from our other leaders on the call today about how their culture, they're just feeling in the community, the atmosphere, how that is, because relaxed seems to be something that was very surprising to me. I believe that, Ronald Heifetz said it best, that this is one of the books in the Leadership Academy, that, us as leaders in the top of the organization really need to be strategic thinkers and being on that balcony and not so much on the dance floor. And I think right now, we're seeing ourselves more on the dance floor. We're all learning together on how to navigate this pandemic. And so trying to balance between the two has been a challenge over the past 9 months or so. So a little bit of other feedback that we received was that the participants identified being flexible as the primary attribute to adjust to change and uncertainty. So, we call that adaptive leadership. And I would say that is really what is the forefront of our organization right now, is just trying to adapt to the change and again, navigate this course wherever it takes us.
Thanks, Diana. One follow-up before we move along is, you have a really close-knit team that I think, I mean, every year you have somebody that's going through the academy, and so really concentrating on their leadership. How has the team gelled or ungelled, or what has that dynamic changed throughout the past 9 months?
I would say that dynamic has remained pretty constant. We're a pretty tight team. Before COVID and during COVID, we have had to go. We've had to really bond together to make sure our residents are getting meals delivered. There is a bit of Zoom fatigue, I think, with all of the meetings, being done virtually at this point in time. But we've also carved out time to just talk to one another. You think about all of the personal connections you have with the people you work with, and being able to ask Johnny how Thanksgiving was as you're passing him down the hall. We don't have all those opportunities anymore, so it's really nice to carve out time just to be with your team, even though it's virtual. We've hosted leadership team happy hours and trivia, just where we're not really talking about work and we're just connecting as people.
Awesome. Thank you, Diana. Jeremy Neely, who is in Pennsylvania, and such a different model because you work for, one of the largest multi-site communities. So Jeremy, talk to us about your experience, please.
So, hi, everyone. I'm Jeremy Neely. I'm the Vice President for the Northeast region with ACTS Retirement Life Communities. We own and operate 26 life plan communities on the East Coast, and I'm happy to have served ACTS for 20 years. So I went through the academy in 2010, and I see several of my classmates on the call with us. So this novel virus, and I use the term novel because it is new, spoke to our need to adjust. It was new. We were learning as the virus progressed. We learned as new information came out. And we had to be flexible, we had to be agile, and we had to rely on the science and the data that was available at the time, and be bold enough to make changes when that data or the science shifted. And our responsibility, serving over 10,000 residents with 9,000 employees, was to keep information in front of them so that they're aware of what's going on. So we found out early on that transparency was everything. Sharing was everything. COVID-19 was nobody's fault. This is a global pandemic. It came to us. Our job was to manage it. And by being transparent, we gained a lot of trust from our residents and our staff. And I also leaned on the Harvard Business Review in praise of the incomplete leader. I call it staying in your lane. I believe early on we got this right by identifying that there are experts in every area, and everybody can't be an expert at everything. We had somebody managing purchasing for the entire organization and making sure that we had PPE in place and we had testing supplies. We had a culinary arm that worked with us to make sure that we're maintaining the different percentage occupancies in our dining rooms in the 9 states that we did business. We had legislative individuals working with us to work with the postal services departments that decided that they weren't going to deliver anymore because there is one COVID case. So from sanitation and cleaning to testing to all of the different departments, we needed to recognize that no one person can hold all of that knowledge. We needed to have individuals who were experts in those areas so that everybody isn't reading everything and bringing information to the table, but we can truly lean on those individuals. So early on, just by talking to our residents, developing regular meetings and letter writings, and if there's a case, tell them. This isn't something where we need to be ashamed of it. We had a case, and guess what? This week, that person recovered. And we're not going to share names because HIPAA is still a reality, But I think we gained the trust of our residents by being transparent early on.
Yeah, Jeremy, you reminded me of our very first case in older adult services in Virginia early on. This was before most had locked down. And I asked the CEO, Westminster Canterbury Richmond, John Burns, how have you led through this? And he said, the first thing I recognized was I am not an infection control expert, but we have someone on staff who is. And so we lean on her because that is her lane. And my job is still leadership, strategy, vision, communication, transparency, but I don't replicate what she does. And what she says goes with regard to that specific lane. And so I appreciate that perspective that you shared.
So with 10,000 residents and the internet, there is a lot of information out there. They're all reading something and coming to you and saying, no, you should be doing this, you should be doing that. It was awesome to have individuals who stayed in their lane and they knew all of those bad reports that were out there, because the internet is not a real source. It's just a place where you get a lot of stuff. It was good to have somebody and individuals who were professionals in their true right.
Awesome. Thank you.
You're welcome.
So as I go around my screen, I'm going to switch to Bob Mayer in the great state of New York, who, I mean, Bob, what you and our other colleagues in New York had to go through early on is nothing short of extraordinary from so many perspectives. So would you share a bit about what's been happening at your campus?
Sure. My name is Bob Mayer. I'm the president and CEO of Weinberg Campus, and we're located near Buffalo, New York. We are a very large single site facility. We have all different levels of care, from nursing home to assisted living, affordable housing, market rate apartments. We also have a fairly significant community-based program. We have a PACE program, home care, and a managed long-term care program, a Medicaid program. So we serve about 2,200 residents and clients a day. And in New York, we were into this pretty early. We had our first case the first week of March. Unfortunately, at that time, we really didn't know exactly what it was. And unfortunately, also was in our assisted living facility, which really was not geared up for a full-scale medical approach to how to deal with it. So I think I learned early on that our folks are pretty territorial in terms of assisted living, wanted to handle the problem themselves, and nursing home kind of handled their own situation. So I really had to get everyone to collaborate. So I think collaboration is something that was really critical, because there are experts in the nursing home that could do infection control, but assisted living really didn't have that nursing component that was able to deal with that. So that was the first thing to kind of bring everyone together. And I think the other important thing was empathy, because you really have to have a sense of where your team is at. And I recall vividly one Saturday in the middle of March where I called an emergency Zoom meeting of our executive team and basically told them that, I'm scared to death. I'm sure you're all scared to death, but together we're going to get through this and figure out how we deal with it. And we're going to do it day by day. And I think that was really a turning point where everyone was kind of like, I was the only one that was scared. Everyone was scared. We ended up with like 24 cases in assisted living immediately and just had to deal with it. So I think that was empathy. I think flexibility was the other thing that I really relied upon, because you would make decisions one day, new information would come out, especially in New York State. We were getting inundated with directives. And you really had to change course almost daily, if not multiple times a day. So really that was important. And I also think that, as others have said, transparency. So we were really the first organization in Western New York that was honest and came out and said, we have cases. We've had a few people pass away. Here's what we're doing to deal with it. And unfortunately, we were on the front page of the newspaper right away. We were in the news. I was interviewed on TV. But I think it was important that we were out there. And I think the other thing that it did for us was I had more than once, I had a staff member come to my office and said, are we okay? Am I going to be safe? Can I go home to my family? Is this what I should be doing? and really had to reassure people that we did know what we were doing, that we had people on staff that were experts. And as long as we follow that guidance, we'll get through this together. But I think this together theme is something I really learned from leadership, is that as others have said, you have to stay in your lane. I'm not an expert in any of this, but I had to bring the team together and use the resources that we have. But it was scary for a while, and unfortunately, we're kind of back into it. And we'll see how the future goes, but it's been challenging.
Yeah, Bob, I think it's so easy for us to pay attention to what's happening internally, but what you've highlighted is that external scrutiny that our sector has been under, as we are, loosely defined as the nursing home, long-term care sector. Everything gets thrown into that, and that you, particularly in New York early on, really had to tell the story. And everybody is responding to some of the bad actors that are out there, while trying to defend their processes. And I imagine that as the leader of your organization, that really had to feel like a punch in the gut.
Yeah, it's still pretty unfortunate that we're not getting the support that we really need. And it's unfortunate the media has latched on to a story or a storyline that's really not true. I mean, there's so many positive things that have happened. So many people have recovered from this virus in nursing homes that it's really hard to get that true story out. But I've tried a number of times, and sometimes it's been successful. And sometimes what I said was edited to turn it into a whole different message, which was unfortunate. But it doesn't mean you don't keep trying. And as long as we know the truth and we know we're doing the right thing, and we've gotten so many thank you notes from families. Thank you for taking care of my mother, my father. It's just, that's what really keeps you going. So, I mean, I think we still have to keep trying to get that true message out, that we're not the enemy, we're actually a solution. And we've really been a major factor in helping to turn this around.
Yeah, thanks for that. What I've told the press when I've gotten media inquiries is that, what our members do is you are extension of the families of these older adults. And so, of course, your top priority is their safety and security and quality of life. I just hope that message continues to be heard. So we'll keep screaming it from the rooftops, Bob.
Thank you.
Todd Andrews, so you have had an interesting little over a year, because you were relatively new with your organization, Asbury Communities. I think you were 6 months in when this pandemic started, and you've had a shift in role. So Todd, if you could tell us a little bit about you and Asbury and what this experience has been like from your perspective.
Sure, thanks. So as Melissa said, I began with Asbury Communities in August of 2019, which was a complete shift for me, coming from working for an organization for 26 years on the for-profit side, to shift to the not-for-profit side, which is the segment I had served my entire career. And I did this specifically not knowing that there would be such an opportunity to serve older adults in a very short time frame. So one of the first things that we were able to do, and by the way, Asbury Communities is 8 communities in 3 states. We serve about 3,300 residents, and we have about 5,500 employees. One of the first things that I got to do before the pandemic was I actually moved into the community, and I was a part-time resident in residential living at one of the communities. And that was specifically to learn kind of from the inside out of what was important to the residents versus what my maybe opinion of what was important to people was previous to that. And that really served me well, because it was the pandemic got going in late February, early March. As Bob said, one of our large community was impacted pretty quickly. We had 30 cases within the first couple of weeks, and the media scrutiny, the local scrutiny, the resident panic that went on was pretty significant at that community, which is about 1,600 residents. And I would use the term kind of being in the game rather than coaching from the sidelines or being in the bleachers, as kind of something that was very evident very quickly for myself and the leadership team. And really, as Jeremy so eloquently said, it was really about learning and pivoting almost by the hour based on what we were learning every minute of the day. And we had experts in various communities. We had infection control specialists that we had put into the nursing and assisted living centers way before the pandemic began, and really leaned on them and their expertise to help us battle the virus kind of from inside out, if you will, and how to put up the barriers to prevent the spread once it got in. One of the things that I learned very early is the power of advocacy as this pandemic kind of rolled forward. And many of you might be aware that in the state of Maryland, Governor Hogan made this deal with North Korea because he got all these test kits flown in. And one of the things that our residents thought is, since we were a large community in Gaithersburg, Maryland, that somebody should have been on the tarmac when these kits flew in and should have been grabbing these to bring them to the community, because you couldn't get testing back, and that you didn't know what you didn't know. So interestingly enough, as you speak, and I have not gone through the Leadership Academy, I will be doing that in 2021, and I'm excited about this. But one of the things that wasn't my normal was really relying on advocacy to help with change. And in a Zoom meeting with a bunch of very influential residents in the campus, I might have made a flippant comment about, hey, if you all start calling the governor's office and maybe writing a few letters, we might get some test kits a little quicker. And I was just kind of trying to break the ice and smooth over the rough edges of the meeting. And literally within 5 days, I got a call from the National Guard that had gotten my name through one of these letters, because somebody put my phone number in the letter, and said, what will it take for the letters and phone calls to stop to Governor Hogan's office? And I said, how about 1,500 tests so we can test everybody next week? Could you do that? And sure enough, a group of 6 Humvees rolled in on Sunday afternoon. Why they needed 6 Humvees to deliver 1,500 tests, I'm not really sure. But the residents felt like that was like the roll-in of, the saving grace, so to speak, because now that everybody will be tested in this one community, we would be okay. And fortunately for us, that was the only community that was affected for the first 5.5 months. We'd have an occasional employee that tested positive, but it wasn't until August, late August, early September of this year that really all of our communities started being impacted by this pandemic. And the only other thing that I would add that my colleagues here haven't said is, one of the things that's been very important to us throughout this entire time is how to get to yes. And what I mean by that is how to get back to some sort of normalcy and be able to say yes instead of no, we can't do that, and this is why, and here's the science behind it, and all those things. We really focused on how to get to yes. How to reopen dining, how to get people into the hair salon, how to do wellness, virtually outside, different ideas that we stole from other people left and right. That's the wonderful thing about being able to serve older adults, is you can steal great ideas on a daily basis from somebody else that can really impact your community. So, how to get to yes, I think, was something that we learned very early. And the only other thing that I would add is, listening to those closest to the process, we made a real, strong effort to listen to the CNAs, to listen to the dining aides, to really understand what their issues were, wherein maybe in the past we didn't listen that closely. When the pandemic started, we were listening closely to everybody's, whether it was a complaint, a suggestion, or anything that went along with that. It was really something that bode us well, and it continues to bode us well through the holidays, as we're dealing with. Right now we have cases of COVID on 6 out of 8 campuses, and some in the double digits. So it's been very important to listen to those closest to the process.
Thank you, Todd. Yeah, you reminded me, in my role, I deal with the state. So it's advocacy all the time. And at one point we just said to the state agencies, let's assume visitation is a must. So how do we get to it safely using all the measures that we need to make? And how do we, from the Department of Health perspective, their number one priority is saving lives. And while we all agree that is important, we also know that in the last years of your life, you want them to be quality. And so how have we been able to balance that quality of life with the security? And I also just want to lift up, giving power to your independent living residents. Talk about, that's just fabulous, because everybody has been looking for purpose through these 9 months. And so to have them be involved, don't tell them at the governor's office that's never going to stop. So Michelle Just, speaking of a community, a state that has kind of entered into this late in the game, being in Phoenix, Arizona, when I think of what you have had to lead through, it's been similar to others, because it's like you're sprinting through a marathon, but there's no finish line, right? And well, now we hope so, with the vaccines on the horizon. But what has it been like to start prepping in March, but not to have really had an outbreak till later than a lot of the folks on the call?
Thank you. So Michelle Just, Beatitudes Campus in Phoenix, Arizona. We serve approximately 700 residents through our continuum of care. We also have a home health program as well as companion program. It was interesting. I remember we pulled together our COVID unit in early March when we first started hearing about it. And we actually had a case mid-March. It was just, we had a family member who came from Washington State to visit his mother, and she contracted it. She lived, but it hit us quickly. And like everyone else, you're having information fly at you right and left. And one of the things we promised all of our residents and staff is that, again, no one's an expert. We're all trying to figure this out too. But as we learned things, we would be very transparent and make sure we were educating people around the process. And I think that served us very well. Any letter I sent to staff, residents, families went up on our website. We had a dashboard very early on. To this day, we still have a dashboard. And I think just that transparency at the beginning of this, like Jeremy said, built up that confidence. I'm not a perfectionist, or I'm not someone who's going to know every little detail, but I definitely want to try to sound articulate when I'm talking. And so, we would do recordings for our residents. This is what we learned today. And this is what happened yesterday. The state released this, and this is what it means. And then the next day, guess what? The state's released something else now. So not that I really wanted to share that pain with everyone, but I think it really helped our staff and residents know we're not alone in this, and they're not alone in this, and we'll be as transparent as we can. The one thing I would add is that I have been so incredibly grateful for this peer group. Right? I went through the academy in 2008. If it wasn't for this tribe, I'm not sure I would have had some of the calmer nights, with some sleeping on some of the nights, because again, people went through it earlier than we did. We did not have our outbreak until late May, early June. So I had learned from a lot, and being able to share with my amazing team at the campus about all the amazing work each one of you are doing brought some confidence and brought some calmness to the situation. So.
Yeah, excuse me. And Michelle, you, like I referenced with Diana, have an incredibly close-knit team who also have had the Leadership Academy experience. Did that help throughout this time, that you'd had that kind of shared experience in the academy?
I believe it has. The two other people who are on our incident command calls with me, we do twice a week Zooms. We've had some guest appearances. Kelly Papa joined for once when we wanted to pick her brain. But what we found ourselves doing at the beginning, before we plan out anything, we do a check-in. How are we? Where's, and that is the place, because as leaders, we don't have this huge network of saying, I am falling apart and I'm barely keeping it together. And it was just nice to be able to have that. Not just with my two peers, but with all of you.
Yeah, I think it goes back to what Bob was saying around being able to be vulnerable and admit that, I'm scared too. I also, one of the things I appreciated that you shared is, I've had to say over and over, people are mad at providers for things that are out of their control, because the feds and the state have put in place requirements that sometimes shift over a 24-hour period. And I think that you have to share that pain with your residents and families, because if not, they think it's you. And they don't understand the hurdles that not only have the hurdles been high to jump, but they keep moving them around on the course. And so just wrapping your head around, these new requirements that's a full-time job in and of itself. So I think that's awesome. So thank you, Michelle. Lynn Giacobbe, you are probably in the most unique position, I would say, of all the folks on this call, due to the nature of Kendall at Home's work. So would you share what has been like for you? Because your leadership is really dispersed because it's not campus-centric.
Yeah, thanks, Melissa. Thank you for inviting me to be a part of this. I too was part of the 2010 Leadership Academy, and I think as I look back on this time, serving in this role, it's going to be almost 17 years that I've been part of Kendall at Home. And, I feel like in a lot of ways that I've spent most of my career preparing for these days without really knowing it. All the leadership lessons, I spent a good part of my career in crisis intervention. So when this first started, I felt like, okay, I got this. This is what I've done, for many years. We'll navigate our way through this. That vulnerability, the transparency, and I think you can do all of those things with your team, but at some point, everybody's looking to you to hold it all together. So you can maybe only go to a certain extent of how scary is this really, Bob? And how much am I really going to be able to manage us through this process? And as Michelle said, I think there are days that without having had the support of one another, for us to be able to really say how scary this is, I'm not sure individually I would have had the strength to face the next day and the uncertainties. In the beginning, our residents or members who live in their own homes were pretty unscathed in a lot of ways. And those that were contracting the virus were those that were already in assisted living or skilled nursing. And in some ways, that responsibility really wasn't on us. That's changed over the months ahead. And I think, as you look at crisis intervention, you're looking at crisis and it's short-lived and you get through that and you move to the other side, and we're 9 months in and we're still not at the other end of this. And we don't know when that will be or what it's going to look like when we get there. So the day-to-day challenges of today's challenge is a positive member, a positive son, which results in a positive member, which then results in a positive caregiver with a high-risk child who's now positive, and agencies refusing to go into the home to provide care. So, at the end of the day, how do we serve our members? How do we find the solutions? And how do we assure them that we're going to be there no matter what happens? We made it through today. Care is in place, but what happens tomorrow? And how do we protect those that are most vulnerable? How do we continue to deliver on the mission of this organization and still provide those certainties? And how do you support the staff who are dealing with it from the professional standpoint, personally, children who are home and trying to be educated remotely, with employees who are working remotely? It's a challenge on a day-to-day basis, and that flexibility, empathy, but still managing expectations, and how do we get the work done, and how do we manage that commitment? All those challenges still ahead of us. I don't know that I know the answers, but I think there's comfort in that none of us really do, and we're doing our best every day to try to get through it and manage as best we can and lean on each other and look to those resources through Leading Age. And I know there have been so many people who have reached out to say, how can I help? What can I do? And those resources, even though none of us really know all the answers, really helps us manage through the day-to-day and get to the other side and still have hope that we're going to be able to keep people safe and do the best we possibly can to serve our mission and those we are committed to serving every day. And in the midst of it all, continuing to grow this program. We're in the midst of probably one of the biggest expansions we've ever undertaken, and it's moving forward. We stalled for a little bit to focus on the immediate here and now, but we're focused on strategy and growth, and that's got to continue. And engaging a board of directors to be brave enough to navigate that with us. A lot of challenges.
Yeah, Lynn, I so appreciate that. It's going to be the perfect segue to Kelly in a second. But, one of the vice chair of my board from Williamsburg Landing, Greg Storer, about 6 weeks ago had a leadership team meeting where he said, okay, folks, we've got this and it isn't going away, but we cannot have coronavirus paralysis. We still have to plan strategically. We still have to grow. We have to do all of those things, Lynn, that you're talking about, faced with this additional layer of uncertainty that we didn't have a year ago. And I'm seeing from my seat, members either brushing off that strategic plan or starting strategic planning anew because, we have to. And that is, and it reminds me on a very different level of that tension when you're in strategic planning, especially from a life plan community perspective of serving your residents of today while preparing for the residents of the future, right? And boards really can struggle with that. And I think it's the same thing now, it's managing this day to day in a pandemic while planning for the residents that different data sets tell us are going to come or not going to come. How do we deal with the reputation of what we do in the midst of all this? I mean, there are newer variables that we weren't considering before. Not to mention the workforce. I know you have shared with our group, we already had trouble getting frontline workers. And for you to have to get nurses to go into people's homes, that is really scary. And so to recruit in general to our field, we know is challenging, but then to add the layer of coronavirus on it just exponentially makes it harder. So
Yeah.
Thank you. And then speaking of the tension of balancing day-to-day operations with long-term strategy, Kelly Papa, we have all had conversations about this. So if you could share about Doncaster and what this has been like for you.
Sure. Thank you for inviting me, and thank each of you for sharing. I was really prepared to say something completely different than what's about to come out of my mouth. It's to go back in time that much is it's really emotional, and my title here, I'm at Doncaster Life Plan Community in Bloomfield, Connecticut, and we serve about 300 residents from skilled nursing, assisted living, and independent living. And we have about 300 staff members as well. So we're small, all one campus. But luckily for us, our health center is a separate building than our main independent campus. So that was helpful during COVID. But and I'm looking at Todd Andrews, who reminded me once when I called him with a strategy question, he reminded me that my core is nursing. And every decision that I make comes out of the fact that I'm a nurse in my heart. And so I hear people parroting me every so often because I'll say, well, my heart is saying this, but my head is saying this. And it seems to be how we've gotten through a lot of the hard stuff when a resident's struggling with going to a wedding. I want to go and I say, oh my goodness, Mrs. Smith, my heart wants you there. My head is trying to figure out how to make it safe. And so we would have all these questions, but I, from the beginning, knew I couldn't do this. Nobody wants to do this. And I was trying to figure out, how do you get out of it? Can we just not have it? And realized quickly that wasn't going to happen. And so relying on all of you so much and our others in our tribe here, I graduated the academy in 2007. It was the first class of the ASA Leadership Academy at the time, Leading Age Larry Minnick's Leadership Academy. And it has been with me for 13 years, and all the people that I get to gather, and I would drive to work some days with each of you in my car going, okay, help me, inform me from your different perspective. What am I going to do when I get there? And it all came back constantly to my values, and I value loyalty, I value transparency, and I'm a nurse in my heart. And so immediately it was taking a page out of a nursing textbook, Barry and Potter, from first year nursing school and saying what you do as infection prevention, you care, you contain, you communicate. And then I added compassion because this was really hard. And so everything we did was based on those 4 words. Eventually we added celebrate, but we didn't want to because we knew how many people were grieving, and it was a big kind of wish that the board wanted us to keep promoting our low numbers, and it wasn't the compassion that I have for each of you, and all that you, this is the compassion I have for all of you as to why we would not push that. And the board was really like, this is a marketing strategy, and which is lovely, and I can see that, but to know the grieving that my peers were going through, and to know it could be us at any minute, was not going to be something we did. So we had to figure out how to care, and as everyone's echoed, the guidance changed every day. And as Shackleton would say, what's in the past, I look future, and you just have to be able to not be upset about that and turn the page to the new page. Also then within caring, it was to make sure we had enough PPE, and we were buying swim goggles and making face masks out of Doncaster tote bags and trying dishwashing gloves and rain ponchos, and with the promise that we would always, if you needed something, just come ask for it. We're going to get it for you. And calling on neighbors to sew masks, and giving family members who are upset tasks to do. Like, can you go find me 25 masks? I need 25 masks. Please go find them. And putting everybody kind of to work at that point under that care umbrella. We were one of the first in Connecticut and one of the first leading age communities in Connecticut to have a case mid-March. Somebody had gone to the hospital and come back, and all of a sudden we noticed and went, oh my word, this can't be happening. And it did. And with that, the Department of Public Health pulled up a truck and dropped off PPE. And it was like the most sad and beautiful moment, because at that point we started to see we were going to be able to get it and started to feel better. Under containment, it was just to teach everyone to understand how to not be on separate floors all day, but then go to the dining room and dine together. So it was the ability to teach people and educate us to why we might not want to do that either. So lots of opportunities for education about containing. And when we did hear of cases for residents or staff, it was, I visualized this for everybody. We're going to put a container over it, right? We want to make sure with an abundance of caution, we're going out a couple layers. Communication you all spoke to, and you all are always in my mind when I think of the transparency of which we communicate and educate all of our stakeholders. So family members, residents, community, and all the staff members always. So we wanted to find a few new ways to do that, and also bring in some technology with some Touchtown apps. But then the compassion part, the nurse in me was not going to ever let, and I know you all echo this, I was never going to not have a family come in if somebody was dying or if they were very frail. And so every time we'd bring somebody into the community, we'd ask 3 questions. The first question was, is this health or safety or compassion? The second question was, is there somebody on staff that could do this for you? So somebody wanted a daughter to come in to remove patio furniture. I'm like, I'll call Michelle. She's down the hallway. She can move your patio furniture. Done, And the third question was just to make sure, could technology do something? So somebody wanted to visualize inside their parents' apartment. Well, I went in with a cell phone and FaceTime, and so I could get in there for them. Which items do you want me to send over to the health? But it was definitely echoing so much of what you all shared, bringing in everybody to the conversation, sharing that goal, and finding answers from all different places. And our residents were a big part of that, right, in our culture, which was wonderful. But the moment I will forever, early on, forever be changed. There was this nurse, and her N95, we got a shipment from the state, and her N95 didn't fit her face. And she was about to go in to care for somebody with COVID, and her eyes, she's like, this doesn't fit me. It doesn't, she was terrified, just terrified. And you looked around, and well, we think we're prepared, but are we? Nobody really knew. And my dad had given me a couple, he may or may not have a bomb shelter, I'm not sure. He had an abundance of PPE. I don't know why. He brought me, and so I said to him, I ran out to my car. It was like my emergency one in my car. Ran out to my car, I grabbed it, and I handed it to her, and I said, okay, this is a Papa Dave mask. This will take care of you. And she looks at me, she goes, who's Papa Dave? My dad is Dave, and my last name is Papa. Do you get it? So but it was in those moments to find humor and to give each person what they needed, the tools to be able to do the job they needed to do. Or I didn't do my job. So I'll get you each a Papa Dave mask.
We look forward to it. Yeah, Kelly, you remind me, so in my role, I got the calls where, the people in our membership, they just needed somebody to listen. I joked I'm bartender and beautician and therapist all rolled into one. And I will never forget one call where a CEO said to me, "You know what I don't want to be anymore?" And I said, "What?" And she said, "The CEO of a retirement community during a pandemic. I don't think I want to do that anymore." And I think that you've all had those moments, right? I mean, I mean, even in my role, I've had those moments. I don't think I want to have another Groundhog Day where we have the same conversations at the state level over and over and over again, but we do it and we keep doing it. And so in our last 2 minutes, I'm going to ask, we assume someone will watch this. And obviously glean tons of wisdom from each of your experiences. But if you wanted to tell a team that was watching this together, one thing that you hope they either take away from this extraordinary experience or they start doing, or just any thought, like what's the nugget for you as you have led your teams through this pandemic? And anybody who wants to, Jeremy unmuted, so I think he's ready. Diana's raising her hand.
Well, Diana followed the rules and raised her hand, so she should go first.
Go ahead, Diana.
I was just going to say, I think what all of our organizations want to come out of this is our employees knowing that they have a purpose, and there is a higher purpose during a pandemic, and that they all have such an important role in keeping our members and our residents safe. And in having that purpose, I think people have a higher commitment to the mission of their organizations. So, just having that be an outcome of all of this is, a silver lining, or as a friend of mine says, the upside of the downside.
Yeah. Our teams are the most valuable resource that we have, the people in the roles, and having them realize just how valuable they are. I agree, Diana. Thank you for that. Jeremy.
Well, ditto. I was going to share that early during the pandemic, I had a turning point where we had the first case in this region, and we've had many cases, but the first one in the region, everybody was afraid. And one of the environmental services employees went into the executive director's office, sat in a chair. This is about a 45-year-old man, and he started crying. And it was fear. And his wife told him not to come home. And all of these things related to what happens when I leave this campus now that COVID's on this campus. And we had to stop in our tracks and recognize that we cannot take our employees for granted. Some of them decided this isn't for me and said, you know what, I'm going to sit this out. But those brave individuals that came to work every day, suited up, took care of residents, some who didn't make it, and kept going and found ways to package belongings with dignity and made phone calls. And those are the people that need to be celebrated. And our jobs are easier, but we have some heroes out there that have not been appropriately celebrated. And I think that's the takeaway, to never miss an opportunity to say thank you.
Yeah, Lynn.
Jeremy, I think that's so critically important. And, every day I try to think about something positive that's coming out of all of this. And I think the growth and strength that our team has demonstrated throughout, I'm sure that everyone's probably had some sense of this, but things that we wanted to do or talked about doing for years, oh, that's never going to happen. And in 2 days, you're putting it together and it's happening. And I hope that it reminds us beyond this pandemic of what we're capable of. Those times when we say, oh, we can't possibly accomplish that. but we have. And so we can. And I hope that those lessons stay with us and that we continue to take those extra steps to get to where we really want to go, as opposed to always thinking, oh, that's too hard. We're never going to be able to do those things. But together we can accomplish so many things. And that together can be all of us together, really improving on our own leadership skills, or really helping to guide our teams, or figuring out where we really do belong. Because for some, really, this probably has been a definitive moment in their careers to deciding that maybe this isn't the right place to be, and being someplace where you feel safe and comfortable and able to do the hard work that's ahead of all of us.
Yeah, thank you, Lynn. I think that ability to innovate, we've had to, and Kelly gave the examples of the PPE, and Todd talked about getting to yes. That's exactly what you're talking about, and being able to make that one of our cultural norms moving forward. And even some of the things that have come down from the feds and the state, being able to make some of those our regulatory norms or not, depending on which reg we're talking about. But I think we have learned as a sector that we can innovate and we can do things differently and turn on a dime if we're given the environment in which to do that. Hopefully it's not always a pandemic environment, but yeah. Anybody else?
Let's hope not.
Right. Bob.
Yeah, I'm similar to Lynn. I think my biggest lesson is really don't be afraid of a challenge. And that's kind of what I've helped our team work through. And, you know, I'm very proud of what they've done, but I think the more important thing is they're very proud of themselves and really look back now and are very rewarded by all the things that they've accomplished and all the things they've overcome and how much they've grown. You know, people have told me over the years that, you know, you start to grow at the edge of your comfort zone. We weren't at the edge. We were like 3 football fields removed from that. Yeah. But people really grew through that whole process and really, I think, are very much more skilled leaders and much more confident and certainly proud of themselves, which I think it's our goal as leaders to develop our team and help them develop themselves. So they really, through this pandemic, and that's one positive, is that it's really a pretty strong team now, and they have skills they never thought they had.
Thanks. Michelle, you had your hand raised.
I keep thinking of Kelly's grandma. I think it was your grandma. That, you know, this has been an incredibly challenging time, but with those words that Kelly, right? Your grandmother?
Yep.
Yeah. Would always remind you, all will be well. All will be well.
She didn't say all will be great. She said all will be well.
Yeah, that's right.
A lot of time on that word. All will be well.
Yeah, that's the, you know, I think we have to remind ourselves as leaders and our teams that these are challenging time, and we'll be stronger at the end of this, and all will be well.
Kelly or Todd, any last thoughts for those watching this? Todd?
You know, I think the word trust is something that is easiest for anybody at any level of an organization to understand. The trust that has been built between employees who may not have saw eye to eye with each other before this pandemic, and how that's changed. The willingness to listen. And I think the willingness to learn and to pivot when we needed to, I think is very important. There's no question that the teams have grown by leaps and bounds through this pandemic in so many ways that I'm really excited about. Once we get past this, how we'll be able to innovate faster. We'll be able to get people to see, instead of having to have 50 meetings to get people to understand why we're going to build a hugging station like I had to do back in March. I'll have one meeting and people will be like, yeah, remember we did that before and how important that was, and they'll just go and do it. And they'll trust that we're not trying to change their lives. Because the one thing that this has done that, you know, especially people who've worked in this field for a long time, who've been maybe a little stuck in a rut or have always done things a certain way, they've had to change. And that'll be something going forward that we'll all yield the benefit of.
Thank you. Kelly?
So the word that keeps coming to mind is the word kindness. but I realized I didn't finish the strategy at this time. So my role here is strategy and community life, Vice President of Strategy and Community Life. And the board is pushing for me to really focus a good 90% of my time. And so it's pulling away the nurse. And I have enjoyed it. And so what's amazing is while I grieve the daily things, the ability to throw something out into the future and then see it there, right? That creative tension, like that's where we're going, that's where we're going, because we've been like bumping in the woods after all these trees. And now to know that there's something in the future, it just is so uplifting. My mother for Christmas wants us to all promise that we'll make strawberry jam on June 10th. And I'm like, okay, that's great. Strawberry jam, June 10th. But since that time, she has given us recipes, stories. She's throwing us through this dark winter. And I feel like although I was kind of in this moment of how am I going to do strategy and the day-to-day and the testing and the contact tracing, it was a gift for us all. So I want to be able to bring the team into whatever the strawberry jam of the strategy is into the future, because I think it'll all fulfill the exhaustion, the kind of the empty well. So that and all the kindness. Thank you all so much. This was amazing.
Yeah, I'm reminded of what Todd said early on when we talked about what we miss the most. And he said planning, looking forward to something. And I think that's the strawberry jam. I want to thank each of you so much for taking the time to share your perspectives and your stories. And what my lasting thought would be for whomever watches this is find your people. Find your tribe, your wolf pack, however you want to describe it, that you can pick up the rocks and look at the squiggly things together, and who will tell you all will be well, and who will send you the strawberry jam recipes. Because I think that this network that we've been able to establish, thanks to Leading Age, is something that is long lasting and will get us through anything. So thank you all for what you do, for those you serve, and for our field. The future is bright because of each of you. So thank you so much for your time.
Thank you.
Okay.